Hi guys, my name is KP Balan. As some of you guys know me from a previous video, I'm a registrar here in Australia and I'm also a clinical tutor. So today what I'm going to do is we're going to talk about recall of the day through a video through my YouTube channel. So I thought that would reach a wider audience of and all the candidates that are sitting for the AMC clinical exam. So before I continue, again I'd like to remind everyone, please do like my video and subscribe. And if you have any questions or comments, please do drop it in the comment section below and I'd be more than happy to come and answer your questions. And if you like more videos this way, please do let me know. It does kind of give me an idea what you guys are looking for. And apart from that, I'd like to thank all the candidates out there who have liked and subscribed to my video and my YouTube channel. Thank you so much for my end. All right, thank you. So now let's start. So today's recall of the day. Now this is a recall that a lot of people, a couple of you guys have kind of approached me asking, how do I approach this? What do I do? Is it breaking bad news? Where do I start? So Lloyd had an appendectomy following rupture of the appendix. It's day two, laparoscopic appendix removal. Patient wants to go home to take care of the mother. Consultant has suggested to stay 72 hours. He's on subcutaneous heparin and IV antibiotics. It's a very common scenario, especially if you're going to work in the surgical ward. And also, we have patients, once the surgery is over, where they like to get back to their daily life. And there's a lot of responsibilities that youngsters have these days to look after the parents and things like that. So it's a very good case, actually. So let's go to the task. You have history. History, everything on. Before I do progress forward, I'd like to thank the recaller. I'd like to give a huge thanks to all the recallers out there who is putting the effort and the time to recall what happened during the exam and to put it on paper to help all these future candidates. It's a great camaraderie, as you can say, I can't say the word. It's absolutely wonderful to see a community like that. Now, moving forward, so the recaller said that everything was normal. There was no signs of bleeding, infections, DVTs, aspirations, or any other post-op complications through the history. And I think the recaller did a really good job of asking the history. Then you have a PEFE in the task. Usually, from what my experience from and my students' experience from what they've told me is that whenever it's a PEFE, usually you don't really have many things that are abnormal. It's one to two things, or everything is normal. So in this case, as you can see, everything in this guy is normal, so which is a good news for the patient. Now, counsel. How do you counsel the patient? And I know in real life, counseling takes a really long time, and it is quite unfair to finish a counseling station within 4 minutes. And I say 4 minutes because your history is going to take about 3 minutes because you have to kind of find out if he has any complications. And then you have PEFE, which is they're expecting you to finish in 30 seconds to 1 minute, which leaves you about 4 minutes in an 8 minute station. And ideally, it's a 10-minute station where you really don't get those 2 minutes initially, do you? And you're kind of stuck out there reading the stem and kind of thinking, how do I approach this case? So, as you can see, counsel. Now, how would I do this case? And what would I suggest to my students? Ideally, I would say spike format. And well, that would raise questions. Wait, spike is for breaking bad news now, isn't it? Well, yes, it is. And I agree with you. And but the problem is that Spike, not the problem, well, the good thing about Spike is it's very organized and it kind of really empathizes with the patient and you make sure you take care of the patient. So why not use something that works for something like this in a counseling station where you have to stay organized and you don't have time to, how am I going to organize this station? Okay. So for me, I would go with the cow spike format. And for this gentleman who has to take care of his mom and has to leave the hospital quite soon and also put himself at a jeopardy, pain and think post-op complications wise, I would say it's slightly a bad news for him. And apart from that, so what I would do is I would start with the spike format, which is the S for the setting. So I would ask if he's in pain, if he's nauseated, if he's having any sort of difficulties, he's able to tolerate his oral and fluid and solids at the moment, because I can't discharge a patient who can't tolerate their liquids and solids and who is in a lot of pain and just keeps vomiting, which would be quite hard to discharge a patient like that. Now, the key thing in this is that you don't have a bias and it's a patient's choice. And if they are going against medical advice, you get them to sign a Dharma form. All right. So that is very important in this case. Now, apart from that, you do have to, everything in the stem is quite important. So this patient has a mom to take care of who's dependent on him, where he's a primary caretaker, which is a very common scenario. And he's on subcut heparin and IV antibiotics. And you can't discharge a patient with IV ABs, and you can't discharge a patient on subcut heparin. All right. So let's move forward. So you have P for perception. How much do you know about your condition? Do you know what has happened? Could you tell me a bit about that? All right. So he'll tell you in 2, 3 sentences. Then you go to knowledge. How much would you like to know about the complications and the issues that you'll be facing when you go home within the 72 hours? He'll say, I'll need to know everything. Good. Then you're going to start with the pathophysiology, and risk factors. So basically, he's had an appendix which has gone inflamed and has ruptured. And then you're going to go into the risk factors that he's had, and then you're going to go with the complications that he's having, post-op complications to be specific. All right. Then after that, you're going to go into empathizing. So you're going to say, I do understand your situation, and I do understand you have a mom to take care of. But don't worry, we're here to help you in any way possible, and we'll have a multidisciplinary team approach. Remember, multidisciplinary team approach is very important. Okay, and why do I say that? Because you can offer respite for the mom as the primary caretaker is in the hospital. And that is a service that Australia does provide. All right. And then the other thing is that this guy has had a nick in his belly, and he needs that wound taken care of if he's going to leave early. So he'll need a silver chain referral as well. All right. Now that pushes us to the support. I would like to ideally divide the support into two categories: pharmacological and non-pharmacological. Pharmacological obviously coming first. I would like to give the analgesics, antiemetics, change the IV ABs into oral ABs. Now the question would be, what do I do with the subcut heparin? The question would be, why is the patient on subcut heparin? That's because he's immobilized. Well, if he's at home taking care of his mom, I guess he's not going to be immobilized. So then, do you really need subcut heparin? And so that's something that you need to think about. Unless he has other complications, such as he's a prothrombotic candidate, then in that case, you might need to switch him over to his anticoagulants, whichever it is, apixaban, and things like rivaroxaban, things like that, or if he's on a warfarin. Again, that's a different case altogether in AMC. And apart from that, you go forward, and now you're going to go to pharmacological and non-pharmacological. In that's where your wound care assistants come. So the wound care nurse is going to come check it out. Silver chain if you're going to get discharged. Respite care for the mom, because even if though he gets discharged, he really can't lift heavy things, and he can't really do the normal level of work that he used to if he's getting discharged within 72 hours of observation. And last but not least, do explain that this is against medical advice, and if it is okay with him to sign a discharge against medical advice form. So this is something that I do daily in the hospital. And this is what we do at the hospital as well. And this is a format that I would suggest for AMC as well. And this is what the Australian graduates here practice as well. Now, I hope this recall of the day has helped you. The reason I did it this way also is because there really isn't much of a differential diagnosis for you to work off of. So I thought, hey, let me help you guys a little bit here. And if you have any further questions, do hit me up. Now, just to sum it up, now I'd like you guys, if you guys liked my session today, please do drop it in the comment section below, your thoughts and your comments. And also, please subscribe to my YouTube channel and like the video. Thank you.